The first U.S. patient.
The first case of novel coronavirus in the U.S. has been confirmed right here in our area.
The first death.
The person who died was a patient at Evergreen Hospital who had underlying health conditions.
Schools and businesses closed.
My overriding commitment always will be the health and safety of their children.
A run on supplies.
They're out of toilet paper and paper towels.
And everybody's going crazy in there.
Confusion about exposure.
We haven't been tested. We want to be tested properly.
The coronavirus has claimed lives, altered others, and virtually changed how we navigate our days. Over the next hour, we will ask the experts the tough questions, your questions, about this new outbreak that for now has no known cure or vaccine. Hi, everybody. I'm Preston Phillips. By now, you're aware there's an outbreak underway of a new virus, novel coronavirus or COVID-19. This is a brand new virus strain spreading from person to person. It originated in China. Health experts are concerned because this new virus has the potential to cause severe illness and pneumonia in some people, especially people over age 60 or those who have weakened immune systems. We saw the first case right here in Everett. That patient had returned from China, survived and recovered. Then in late February, we learned of a concentrated outbreak at Life Care Center of Kirkland, a nursing home. It became the epicenter of the outbreak. Things are changing by the day, as you know, sometimes by the hour, but we've assembled a panel of experts to help navigate the unknown. We know a lot of you might be feeling anxious about this outbreak as the number of cases continue to climb. Well, that's why we have the director of the UW Center for One Health Research, Dr. Peter Rabinowitz. He spoke with KOMO's Kelly Koopmans, answering some of your most pressing questions.
You know, we were talking about one thing that you wanted to touch on is we have the whole plan right here of plan, don't panic. But you say it goes beyond not panicking, but really about coming together. Why don't you explain that a little bit?
Yeah, I think that like other types of natural disaster, this can really bring out the best of us. It can really show that we can realize the situation, realize how serious it is, but all the things that we can do and take steps to just in our home, what we can do to get ready, be prepared for any more disruptions to daily life. It can be in the way that we reach out. It can be in the way that we pressure government and business for things like getting a test here faster, getting more supplies like masks to the people in healthcare that need them. We can put pressure on where it needs to be put to try to get that thing to happen. We can learn from the examples of other countries that have experienced these kind of significant outbreaks. We can share information. We can find ways to just reach out to family, make sure everybody's okay in all this. And so there's a lot we can do. And I think for kids to see their parents working on strategies and as we adjust to these changing realities, I think can be a lot of positive parts that we really should take out of this.
Do you feel like Washington State is on the forefront of this? Have you been hearing from maybe colleagues from around the country trying to tap into you and see what you know?
We're definitely in just a focal area of this problem, and we're certainly hearing from colleagues in other places asking us how we are handling it. The medical system, the doctors in the hospitals are doing an amazing job. I'm really proud the University of Washington has the test up and running and doing hundreds of tests a day. There's been just a lot of great work by the public health department, both in the county level, at the state level, people really working together and just top experts cooperating. Things that on a regular basis, we don't see that kind of contact. We don't hear about all this kind of collaboration on a regular basis, and this virus is giving us a chance to realize how interconnected we are and how many great people we have in the state of Washington to work on this.
Let's touch on testing just a little bit there, because we were kind of behind the 8 ball when it came to that. Why is that? It's
been a frustration. There was originally all the tests going through the Centers for Disease Control. The kits were being distributed. There were some problems with the kits. Some of them had to be returned. The state lab was able to start testing but it takes a while, and it's still getting up to full capacity at the state lab. And the private labs are supposed to be coming online, but that has not quite reached its full capacity yet. And fortunately, the university has been able to get its testing going. So all these pieces, I think things could have moved faster somehow. And we're certainly going to learn from this about how in the next time we can avoid these kind of slowdowns.
So was the infrastructure just not there in the first place to be able to deal with some sort of pandemic?
I think the infrastructure was there to deal with probably a smaller scale type of problem that didn't move quite so fast. And as a result, I think we really are looking at how we can gear up more quickly in the next situation. As a result, we're still catching up with the number of true cases that are out there in the community and the true extent of the problem in Washington State.
A lot of people want to go back to the source. They want to say, how did it get into a nursing home? How did it get into Washington State? But you say it's important. Where did this come from in Wuhan originally? What was the genesis of this virus?
Yeah, we've been so busy with developments in our local community, our local state, that it's sort of on the back burner. The question is, we still don't know why this broke out in the first place. But if you look at emerging infectious diseases over the last several decades, most of them have actually come from animals, and many of them actually come from wildlife. And we know that this virus, like the two other novel coronaviruses, SARS and MERS, actually came from bats. And so why are we getting bat diseases ending up in our community? And really, it goes back to where the bats started from and in other places in the world, where there's been habitat destruction, where animals are often, there's contact between wildlife and large concentrations of animals that we're raising for food. And sometimes in the market, we are marketing animals altogether in live markets. And this kind of activity gives the viruses a chance to jump from bats, where they've been hanging out for centuries, not causing any problems, all of a sudden to animals and then to people that are causing these kind of outbreaks. And we have to think about the ways that we are interacting with wildlife, the ways that we're hurting biodiversity around the world, the way we're destroying wildlife habitat, and how that interacts with the ways that we're raising more and more animals for food to feed a larger human population. If we don't start also changing our methods of doing that, we're at risk of having more of these what's called zoonotic, coming from animals to people diseases. So we have to take that as one of the lessons of coronavirus, to take steps about that, just as we're taking steps to try to keep ourselves safe in Washington and deal with a national epidemic that we're still not seeing the peak of.
The governor had some sobering statistics. He said of the number of cases can double every 5 to 8 days. Is that something that you see is realistic? And does social distancing help address that?
Well, the cases are already there. Part of it is diagnosing the cases in terms of the testing results and things like that. Social distancing is going to help slow down the ability for one infected person to infect other people. If we can keep that infected person just at a bit of a distance, so that if they sneeze, the droplets don't quite reach other people, if there are just fewer times a day where that person shakes hands or has direct contact with somebody else, that's going to give less opportunity for the virus to cross to other people. So we're just in an effort to slow the whole thing down a bit and let it run its course, while we're doing everything we can to keep people healthy, to take care of the sick people, to work on an antiviral agent, which we're hoping will be available in several months. And we just want to keep the epidemic under control as much as possible with these kind of methods.
My last question is, people are having a lot of disruption to their everyday lives, whether their kids are not in school or they're working from home. How long term of a problem do you see this in terms of disruption of everyday life? Are we looking at weeks, months?
I think we have to look at Europe and South Korea. These outbreaks have gone on for at least several months. So I think we cannot expect in a week or two everything's going to be back to normal. This is going to be something where we're going to all have to work together hard for the next weeks to months. And fortunately, it's showing, again, some of the best qualities of what we can do together to fight this.
Okay. Is there anything else that you would like to add?
I think that, taking good care of yourself, getting good sleep, getting exercise, really paying a little more attention to our health than we do on a regular basis. This is a very good time for that, and to really be very grateful when we are healthy, and if you're feeling sick, to really recognize that and do something about it.
Take your steps. All right. Thank you so much.
All right.
So what can you do to protect yourself at home? KOMO's Holly Menino shows you.
Schools are closed and companies are telling their employees to work from home. A COVID-19 outbreak is happening, and we are here to help you plan and not panic. Here's what you should do to keep yourself and your family healthy. At home, clean and disinfect frequently touched surfaces like tables, doorknobs, and light switches. At work, clean and disinfect commonly touched surfaces or shared spaces like your desk, computer keyboard, or phone. The CDC does recommend wearing disposable gloves, but if you don't have a pair of gloves, just wash your hands afterwards. Try to avoid touching commonly used surfaces like an elevator button or door, and no handshakes, elbow bump instead. Whether you're at home or at work, you can take matters into your own hands, including washing those hands. And there's a right way to do it. You want to start with warm water and soap. You want to wash for 20 seconds. You can sing that happy birthday song twice or listen to these additional tips. Limit close contact with others, about 6 feet. Stay away from others who are sick. Stay home if you're sick. Avoid touching your eyes, nose, and mouth. If you don't have soap and water available, use an alcohol-based hand sanitizer that contains at least 60% of alcohol. When you're coughing and sneezing, cover your mouth with a tissue. When you're done, throw that tissue away and wash your hands. Don't have a tissue? Use your elbow instead. The CDC recommends using these preventative actions to keep you and your family healthy. Reporting in Seattle, I'm Holly Menino.
Coming up next, why you should call your doctor before heading straight to the ER if you suspect coronavirus. A 37-year-old Seattle woman who says she tested positive for COVID-19 hopes others will learn how easy it can spread and how long it can last. Here's KOMO's Suzanne Fawn.
I did get a phone call from them on Saturday saying that I had tested positive for COVID-19.
Elizabeth Schneider says when she got word from Seattle Flu Study that she had coronavirus, she was shocked.
I thought, oh gosh, I probably just contracted a flu strain that isn't covered in my flu vaccine.
Schneider says it all started after she attended a small house party on February 22nd. 3 days later, though, she came down with a fever. It spiked at 103.
Starting to shiver and, get the chills.
On March 1st, she decided to get tested by Seattle Flu Study. She said she got a call from the research group 6 days later. They told her she tested positive for COVID-19.
They did send me a follow-up email afterwards, and then they sent me some attachments related to, what you should do if you've contracted COVID-19.
The CDC says the primary symptoms of the virus include fever, cough, and shortness of breath.
I didn't have a cough. I didn't have tightness in my chest.
Schneider says she never went to the doctor because she started to feel better. As a 37-year-old woman without any underlying health conditions, Schneider says she's not in the high-risk group.
I think there are a lot more people out there who are experiencing these symptoms and are just kind of writing it off as a cold or a nasty flu, but in reality, they most likely have the coronavirus and could potentially spread it to others.
In Seattle, Suzanne Fawn, KOMO News.
We reached out to Seattle Flu Study, but haven't heard back. We also reached out to King County Public Health, but they said they couldn't independently verify COVID-19 cases. Schneider says she's never needed to be hospitalized. She says she's no longer in isolation, but is still avoiding strenuous activity and large crowds, and she's working from home.
Hi, I'm Cassie Sauer, and I'm the CEO of the Washington State Hospital Association, and we're the not-for-profit membership association of all the hospitals in the state.
This is sort of an unprecedented, maybe not unanticipated, but an unprecedented event. What's sort of the positions that our local hospitals are in, sort of at this point, kind of looking forward to the weekend and next week and those sorts of things?
I think the first thing I would say is the hospitals have done an amazing job of caring for the patients that have come to them. I think one thing the public may not be as aware of is that hospitals are releasing patients now, or sending patients home who got better. So patients who have coronavirus, were sick enough to be hospitalized, were treated very expertly by the hospitals, and are now being released because they're better, they're well. And that's a remarkable thing, I think, that's happening in our community. But the hospitals have they've had to stand up their emergency operations centers. They've activated all kinds of emergency plans, added new rooms, changed their screening guidelines, really put a lot of things in place to help care for patients.
So it's important to know that people are getting better.
Absolutely. I mean, that I think is it was just fantastic news that we have patients that are being sent home. They're well, and they're being sent home who were treated, and that's just amazing.
What are the concerns going forward as this grows? What can hospitals do to mitigate those overwhelming numbers or other issues?
Well, I think the question is, what can the public do to help mitigate those numbers? And that's really, I think, the governor's order about how can we increase social distancing, decrease transmission. What we want to do is slow the growth of this virus, slow the transmission. I think it's going to be transmitted among our population. We want that to slow down. And the reason for that is you don't want to overwhelm the healthcare system. You want the healthcare system's resources to keep pace with the spread of the virus so that we can care for everyone who needs it. And so that's so that for people, if you feel sick, stay home, wash your hands, limit your social contacts. Now you couldn't go to a big event now because the governor has made them illegal in our county, and the surrounding counties, but really being very careful about how live your life, but be careful about it, especially with people who are most vulnerable. So folks who are older, people who have underlying health conditions, immunocompromised, that they, if you have any sickness, you should not be anywhere near people who are in those categories.
There's still, this is a new disease.
Yeah.
We're still getting new and conflicting sometimes information about it. How do the hospitals stay up to date with the latest? And sort of how do you anticipate that changing as we move forward?
So I would like to give huge kudos to the Washington State Department of Health and our local public health departments for their work together. They have worked with the local hospitals and with us at the Hospital Association to get information out to hospitals. But you're absolutely right. That is something that's been, it's very challenging to operate in the middle of a crisis that you don't know what the crisis is or what the parameters are of it. What's the path of this disease? That's why I'm so excited about people getting better and getting sent home. Like that path of the disease we weren't totally sure about either, and it's fantastic to see it happening. But I think that's really where the information is coming from, and a special thanks to Dr. Kathy Lofi, who is our state health officer, and John Weisman, who's our state secretary of health. They've done a tremendous job of making sure that people have the latest information, and that it's very science-oriented, that this is not a political issue, this is very much based in science.
What challenges do our area hospitals face as we go forward to the next stages of this pandemic?
Yeah, I think the biggest one that we're facing right now is supplies, making sure that we have enough supplies, especially personal protective equipment like masks and gowns. But a second challenge is making sure that the workforce is available, that we have enough workers to care for people who need care.
What sort of extraordinary measures are hospitals and regulators starting to take to deal with this?
The hospitals are very much working through the Hospital Association to identify the regulations that and laws under which we need flexibility to be able to best care for patients. So as an example, a drive-through COVID testing site, it's not a real clinic, and there's laws in the state about what a clinic needs to look like, and it's the size of its walls and the fire protection equipment it has. We need to be able to have those testing sites operate essentially as mobile clinics. We just got from the state today, which we're delighted about, some guidance that hospitals can use out-of-state workers as emergency workers, so like a nurse who's licensed in another state, to provide virtual care. So Kaiser could use its nurses that are in Colorado to staff its nurse hotline. We're wanting people to use virtual care. People who think they may have COVID are obviously worried. They want some consultation with a healthcare provider. The best consultation is over virtual care, where they don't have to go into a health system. They're not risking infecting anyone else. They're getting consultation who then would say, yes, you should go get tested, or no, you should just stay home. So that kind of flexibility is tremendously helpful, so we can be making sure that we can care for everybody in the most efficient way.
Have you heard from other hospital associations around the country, since we're sort of the tip of the spear?
Yes, I am sending, I send daily or every other day updates to our members about what's happening in Washington State. You know, things like we're working on drive-through testing, or we need guidance about particular things from the state, and we're getting a lot of interest from them. And my intent in doing that is so they're prepared for the things, you know, sort of like, here's the waves that are coming your way. Start getting your drive-through testing set up. Start getting your virtual care lines ramped up. You know, those kinds of things that we've been working on, trying to help them get there.
A lot of folks with chronic conditions need to come to the hospital, different service centers all the time.
Yeah.
What should they be doing? Should they be avoiding? What's
right? Yeah, they should not be avoiding. They should definitely keep getting their care. A big concern for us is if people decide not to go to the hospital or clinic and their condition gets worse, then they could end up as an emergency. And for folks who are getting care for chronic condition, the whole point of that is you keep them from getting to an emergency state. So they should check in with their doctor's office or clinic, but our advice right now is you should keep your regular appointments, make sure you're keeping up with your health. That will help the healthcare system. If folks with diabetes or Parkinson's or whatever the condition is are keeping themselves in good shape.
COVID-19 is new, but it's definitely something you guys are prepared for.
Right. Hospitals care for many people that have infectious diseases. It's one of the main reasons that people need hospital care. And there's a lot of planning that goes into thinking about how to care for patients if there were to be an eruption of an infectious disease, as this is. But the H1N1 was a good example of hospitals really putting that preparation into effect. We've had some serious flu seasons in the state, so it's definitely testing hospitals, but it is also something that hospitals spend a lot of time thinking about and planning for.
The death tally that we're all watching day by day, week by week, shows up as a number. And behind those numbers are names and faces and loved ones and family members. One such family member reached out to me. They wanted to talk about their father and husband. They didn't want him to be remembered as just a number.
COVID-19's ripple effect of grief has landed here at this home in Kirkland.
Family was the most important thing in his life. He loved music. He was passionate about fishing. He loved to cook. He was a better cook than I am. One of the reasons I married him.
On February 21st, Eric Zanassi, who worked as a truck driver for 30 years, visited his mother, Jamie, at Life Care Center of Kirkland. There was cruelty in the timing.
The next morning, we got a call telling us that Life Care was on lockdown.
A few days later, on Monday, February 24th, he was admitted to Evergreen Health, where 11 souls had lived out the final hours of their lives because of coronavirus. Just after midnight, early in the morning of the 27th, Eric Zanassi became number 12.
If we had gotten the call one day earlier, would it have made a difference? I don't know. We might still be having this conversation. I don't know.
He was 61 years old, and it's important to understand that Eric was not a well man.
He had multiple health issues. We keep hearing about the people that have died having underlying health problems. But what we don't hear is, what does that mean? In Eric's case, he had diabetes, he had high blood pressure, he had chronic atrial fib, he had peripheral vascular disease.
Eric's mother has since been moved to Evergreen. She can't hear, so family can't call her. They aren't allowed to visit. The Zanassi family doesn't even know if she knows that her son is gone.
You know, it's selfish, but I almost hope she doesn't know.
The family is brokenhearted, grieving, but they're not angry, not at Life Care Center or anyone else.
Oh, goodness, no. They are dealing with an impossible situation. They are being castigated by so many people who have family members there who aren't realizing that they're doing the best they can with the staff that they have.
The outbreak continues. Another family mourns, and COVID-19's ripple effect of grief looks for other places to land.
Teresa Zanassi says that when her husband Eric went to visit his mother on February 21st, there was already at that point a lot of talk about coronavirus, but the link to Life Care Center of Kirkland hadn't been made yet. At that point, she says he was just a guy going to visit his mom the way any son would.
The largest school district in the state is closed. That's 104 schools, 53,000 students, and 12,000 staff. School districts and colleges around the region are also closing or turning to online learning as parents scramble for childcare and continued education. The governor has banned events over 250 people. The county executive has banned even smaller groups. He spoke with KOMO's Kara Kostanich.
As COVID-19 continues to take a grip on our communities, we continue to ask for answers. I'm joined by King County Executive Dale Constantine today. Thank you so much, Executive, for your time.
Thank you.
We know that the King County Council has allocated $28 million for COVID-19. Can you talk a little bit about what that money will be allocated for?
Yes. Well, we are freeing up funds that was supposed to be used for other purposes to do things like set up isolation and quarantine facilities, to make sure that we have the personnel to respond to the expanding number of cases, and really to take what the World Health Organization called a whole government approach. This is not just public health coming to the rescue. This is all of our departments and divisions, every person figuring out the thing that they need to do to help the community get through it. That costs money. We know that the federal and state government have appropriated funds to help reimburse us, but for the short term, we need to move county funds around to be able to execute this immediate response.
How many quarantine sites will we see here in King County?
We will have up to 1,000 county created quarantine or isolation units, and that is not going to be all that is needed. We know that we're going to have situations where a nursing home or a shelter or possibly even a detention facility has an infection, and we have to move people out to get people farther away from each other to prevent the spread of that infection. So this is going to require not just county governments, but the state and the federal government to help us have that kind of capacity.
When you say detention facility, where would those folks go?
Well, first, we have several empty floors of our west wing of the downtown jail, and we're looking at how we can use those, particularly for inmates who are in a high-risk group. They're older or they may have underlying health conditions. I've ordered our folks to immediately get those inmates separated from the rest of the population, get them apart from one another so they're less likely to become infected. We're taking many other measures to try to prevent infection from coming in, but the fact is that with hundreds of employees coming in and out of the facility and thousands of people really in the criminal justice system, it's very difficult to screen that out.
How are you specifically selecting these locations?
So for detention, we're looking at places that were already built for detention or can be used effectively for detention. The West Wing used to be part of the jail, and it was essentially decommissioned. We've been using one floor and soon to be two for shelter, but there are many more floors that could be repurposed, put back into use. For the people who need to be in isolation, recovery, or quarantine, we are finding places all around the county, as you've heard, an old motel, warehouse space, office space, vacant land on which we can stand up modular units or even tents. Anything we can locate in every corner of the county that will accommodate people who either don't have a place to go and be in isolation and protect others or can't go home because their home is not the kind of place where they can avoid infecting their family members.
What can you say to those neighbors and businesses who might hear that and think, I don't want this in my neighborhood?
Right. Well, it is going to be in everyone's neighborhood around the county. And the fact is there are people in every community right now who are positive for the coronavirus. So these are facilities where people can be inside, be in isolation, recuperate, and when they're no longer contagious, can go home. And that is the responsible public health approach. It is a fact that no one wants a facility of any kind in their community, but this effort is going to require us to have places north, south, east, west, and here in Seattle where the city government has been very forthcoming in providing space.
And will these locations be voluntary?
They will be voluntary. Public health does have the authority to order someone into quarantine or isolation if they're unwilling to go. We don't anticipate that being a challenge. But it is a fact that under these circumstances in particular, our public health officer has broad authority to insist that people not infect others, that they take the steps they need to take to protect the community.
And what does that order look like if you are forced into isolation? Would you guys do that?
Yeah. Well, again, we don't anticipate doing that. But it is possible for them to seek an order from a judge to say, this person has tested positive and they're insisting on continuing to circulate in the community and infect others, and have the judge order that person to be in isolation.
How much do you think that will help, having these folks in isolation?
Well, having people generally in isolation is critically important. You go into quarantine if you have symptoms and suspect that you may be infected. Some people who have symptoms may have something else. They may have a cold, they may have allergies, and if testing increases, we'll be able to more quickly reassure people and let them go back to their jobs. For people who are in isolation, that means that you know you have the coronavirus and you need to be somewhere where you're not infecting others and where you can comfortably recover.
And we know that many people are honoring this ban not to gather in groups of more than 250, but what do you have to say to those folks who are choosing not to honor that ban?
Well, that is, it would be irresponsible for people to gather in large groups without taking the precautions that public health has recommended for social distancing and sanitation, to discourage particularly vulnerable people from coming to these events, and to check your employees on a daily basis to ensure that they don't have symptoms, they don't have a temperature, they don't have a cough. All of these things need to be done if you're going to protect not just the people in your venue, but all of those that they might come into contact with after they leave.
Dow, we really appreciate your time. You stay healthy, you keep your staff healthy for us.
Doing our best, thank you.
King County Executive Dow Constantine for us today. Back to you in the studio.
Coming up next, many are asking about the access and availability of tests. Why aren't more people getting tested?
Well, we're at the Department of Health, their Shoreline Lab today. We're with Dr. Scott Lindquist, and we're talking a little bit about testing. So my first question would be, how many people right now are being tested every day here in Washington?
Yeah, so that's a difficult question to answer. I can give you some ballparks because as we go day by day, there's more labs coming on board. So at the Shoreline Public Health Lab, we don't have a backup anymore. We were backed up for a little bit, like back over 700 samples waiting to be run, but we're doing upwards of 300 plus samples a day here, and we have no backlog anymore. In the meantime, the UW Virology Lab has come on board, and they were projecting they could do about 1,000 per day, maybe up to 1,500. And I know they're getting close to those numbers at this time. So in addition, some of the more commercial labs like LabCorp, Quest, AREP have been adding on. So it's hard for me to know exactly how many they're doing every day, but we are getting positives from all of these labs.
Do we know how many test kits there are in Washington?
I don't know how many test kits are here in Washington because a lot of these test kits will be in private labs or university labs or commercial labs. But what I can tell you about the test kits, CDC has been great about making sure we've got enough test kits. Yeah, we had a little bit of a problem over the weekend, ran out of some reagent, but CDC was very quick to make sure that we had enough to keep going.
Do we still have a shortage?
We do not have a shortage at this point.
What's the exact criteria for getting tested?
So the truthful answer to this is there is no criteria anymore. Anyone that wants to be tested can be tested, but you do have to go to your doctor or your medical provider, and your medical provider has to deem that, one, they can obtain the sample in their office, which is very complicated because that person has to put on an N95 mask, has to wear a gown and gloves, and has to have the PPE or personal protective equipment to be able to put a swab in your nose. And the reason why that level is so high is because a person could cough or sneeze or cause an aerosol into the face of the person obtaining this specimen. So realistically, the biggest limitation is that personal protective equipment. Do the doc's offices and providers' offices across the state have enough to do this? And the answer is no.
And maybe you're touching on this there, but we've heard from several people who have said they feel they have the symptoms of COVID-19. They are attempting to get a test, but their doctors are refusing them.
Right.
Why is that happening?
Well, it's for various reasons. Sometimes the doc will see the patient or the medical provider will see the patient, and the patient doesn't have any symptoms. They just want to know. So there's a lot of times providers will say, no, you really don't have the criteria of any testing for any respiratory illness, let alone flu or COVID-19. So realistically, a fever and a cough is what people should be looking for as the most common symptoms. Go in. But again, the biggest limitation is, does your provider have the personal protective equipment to be able to obtain the swab?
So I guess, how do we get to where we need to be then to get these people tested? What's the next step?
We need PPE. The state desperately needs N95 masks, gowns, and gloves brought into the community. And unfortunately, there just isn't any coming in very fast.
Who can help with that?
Well, a couple of people. So we work with the federal government, the CDC, and we're asking daily to prioritize this. Now, if you had to prioritize who you gave the mask to, would you give it to someone who needs to be tested, or would you give it to someone who's taking care of a patient in a long-term care facility that has the disease, or the person that's transmitting them, or the nurses, docs, or any medical providers? So unfortunately, that's what is happening, is all the prioritization is going to those that are taking care of very sick patients. Eventually, we should get enough PPE sent into Washington State, but as you know, the rest of the country is also now starting to see cases, so this demand is higher and higher. I don't think the test is the limitation anymore. I think the PPE is the limitation.
My name is Deborah Fuller. I'm a professor in the Department of Microbiology at the University of Washington School of Medicine. And we are currently in my lab, which is the molecular biology lab that's designing our vaccines for COVID-19.
The first question folks would like to know is, what's sort of your guesstimate on when these vaccines and solutions to this disease will be available?
Yeah, I think that the guesstimates are about a year. You first have to make the vaccine, and then you have to test it in animals, make sure it works, right? And so we're in a discovery phase. Usually takes, for a lot of vaccines, that can take 3 to 5 years. For the DNA and RNA vaccines, they can take between 2 to 3 months. And the next step is really to move that into human clinical trials, okay? Because you can't release that to the population until you've tested it for safety and immunogenicity in humans. And that process requires a production of the vaccine under excellent laboratory practices to make sure it's clean and sterile and ready to go in humans. And it also requires a lot of regulatory oversight from the government as well as other bodies to, you have to check a bunch of boxes. And that takes a little time to get that going. Then you have to recruit people for the clinical trial, and then you have to get approval for it. And that takes a little bit of time to do that. Phase 1 trial, we might enter in 3 months from now, but that could then take another 3 months just to complete that particular clinical trial. And then you'd have to go into a phase 2, okay? And that's then validating the initial results, and it's a larger group of people. Sometimes the phase 2 might include people who are at greater risk for side effects of vaccines, like the elderly or the immune compromised and the like, because you want to make sure it's safe in all different types of populations. Now you're adding another 3 months, so you see we're about 9 months along the line before we can start to even think about putting that vaccine into the population. But until then, I think everybody needs to just stay vigilant, on the practices that have been advised, that we're all aware of now, washing hands and the like, and be hopeful, because these interventions are coming. We have the ability, we have the tools, we know what needs to be done, but it does take time.
Spring break, weddings, work trips, a travel ban. Many are asking whether they should be traveling by plane, ship, or train. KOMO's problem solver Connie Thompson looks at whether you should get travel insurance in light of coronavirus.
If you buy standard travel insurance for your trip, you're still covered for unforeseen events that are not linked to coronavirus. That's the kind of coverage that helped Adam Uri and his wife during a trip to Thailand when he broke his foot. His medical bill came to $1,000.
I went to the hospital, paid for everything out of pocket or a credit card. And then a couple months later, after submitting all the documentation, I got reimbursed for the cost of that.
In general, because coronavirus is a known risk, most standard travel insurance covers trip interruptions and cancellations for reasons other than coronavirus. So your best bet is for compensation coverage called cancel for any reason. With Cancel for Any Reason insurance, you have to buy the policy between 5 and 21 days of your first deposit. That depends on the company. And the cost is between 5 and 10% of the price of your entire trip. Go online and you'll find dozens of companies that sell travel insurance, so it's important to compare both cost and coverage terms and conditions.
Taking care of your emotional health is just as important as your physical health. What you can do next.
The coronavirus pandemic has brought about a lot of changes at work and at home, and there's a lot of uncertainty about what's going to happen next. If you're feeling anxious, just know there's help.
I see it all over my social media, people just feeling kind of exhausted.
If you're feeling stressed or anxious about coronavirus, you're not alone.
I'm stressed about everything, my job, scared of being sick, scared of losing loved ones.
Crisis Connection says its crisis line has seen a 25% surge in calls in the past 2 weeks. People worried about the health pandemic, their job, money, their livelihood.
Basic needs become a real concern for folks to say, if I can't go to work and I'm an hourly employee, how will I pay the rent? How will I begin to take care of my family?
At the same time, many places like St. Mark's Cathedral are temporarily closed to the public. Dean Stephen Thomason understands and says people are worried.
The concern that people are expressing is about the unknown of how long will this take for us to be able to gain some semblance of normalcy again.
Faith leaders, doctors, crisis centers offer some solutions to help you manage your anxiety. They say plan ahead to feel more in control.
So really looking at what you can do to cope and understanding that there are things that are not in your control, but there are things that you can do.
Unplug, learn to be in the moment. Prioritize good sleep. Exercise and eat well. Wash your hands and embrace the elbow bump. Crisis Connections reminds people there's help. Besides calling the crisis line, you can call 211. It connects you with the resources you need.
Housing and shelter. This would be looking for the location of the nearest food bank or how someone can get connected to legal aid or for resources that would help them prevent an eviction.
The behavioral health doctor I spoke to here has some more suggestions to help you control your anxiety. She says make a list of things you're grateful for that give you value and meaning in your life right now. She says call a loved one, take a walk, or do some kind of activity with your kids that you never have time to do. Basically, take those temporary changes and make them work for you. In Seattle, Suzanne Fawn, KOMO News.
We here at KOMO hope we've been able to provide you with the facts that will allow you to make the best decisions for you and your family. For a variety of coronavirus resources, go to our website, KOMOnews.com. I'm Preston Phillips. Thanks for watching.